All right, so I'm going to take this one, and it's kind of a tough topic, right? You know, centers of excellence, how will it impact the regional care for, you know, for cancer or quality of whatever measure, and I'm still working for the same group. All right, so this is going back to the question, the study on lymph nodes, all right? So there's nothing magical. Routine reevaluation should be done. And chemotherapy, what should we remember about that? All right, if you have less than 12 lymph nodes, remember to offer it to your patients. Good, okay. Just trying to make sure you take one take-home message. Here's my take-home message. It's my view of the world, which means when you see this little thing on the slide, it's just opinion. There's no science or data behind it. We got plenty of data, but we have very few answers, I'd say, when it comes to centers of excellence or what to do. But I think we're all, you know, Dave's talking about, we're all talking about wanting to do better for our patients. And I think the reality of this is we're not. So let me just find out what we're doing here. How many of you do more than, to be honest, how many of you do more than 20 colon resections a year? Probably a little more than half. You do laparoscopic colectomy? Should be the majority, I would say. How many of you see more than 4 rectal cancers a year? So we got my colorectal groups. Because in America, that's not really true. The conclusions, there's a lot of variability in what we see. For surgeons, you know, volume, training, and technique matter. For the patient, having the whole team together really matters. And where practical, centers of excellence make sense, opinion. So how do we really do? I mean, we're all, you know, most of us are out there, and I think those of us that are academic centers, you know, we see the patients where they're 10, 15 miles away and things have happened, and you're wondering, you know, where they're really coming from. We do great in some, and I think we do poorly in others, and across the country. I don't think we're anywhere near where we hope we would be at this stage. And why is it different? Well, we've talked about it already this morning. I mean, the techniques have changed in our careers, what we're doing. The technology changes, which allows us to do more, potentially more things, but now you've got to learn it. And our knowledge is expanding tremendously in every area of this. And it's not just surgery, right? I mean, just think about what's happening to our oncologists and the chemotherapy drugs and how they're used and where do you give it. You know, do you give Xeloda, or do they get a pump with 5-FU? I mean, there's just so much variability of what we can offer, and then trying to find the right answers is really hard. You know, radiation oncology. How many of you, I'll give a case scenario. You've got a gentleman who's 50, he's obese, he's got a distal rectal cancer, and